Thank you so much for joining us at the National Spine Health Foundation's series on raising awareness for the research of spine treatments. And I'm extremely excited today to bring to you Dr. Jeffery Gum. Dr. Gum is all the way from Louisville, Kentucky, joining us today. He is a spine surgeon at Norton Leatherman Spine Center. He specializes in adult and pediatric spine deformity surgery and robotic-assisted minimally invasive surgery. Dr. Gum is involved in extensive research focusing on adult spinal deformity, robotic-assisted spine surgery, and the economics of spine care. So he is perfect for this discussion today. Thank you for joining us, Dr. Gum.
Thank you. Thanks for the opportunity.
Excellent. Well, we could go on and on about all the things you're doing today and the things you've done over the years, but let's actually backtrack a little bit and talk about what made you want to study medicine and how you got into spine surgery specifically.
Yeah, great question. So from a medicine perspective, I was always interested in the sciences, which I think the majority of us are. And then if I go back and look at my interaction with kind of medical professionals growing up, it seemed to always be sports injuries, right? So there's always, some sort of athletic injury. And so most of the time it was the orthopedist who I was interacting with, fortunately, versus, some chronic medical condition. So I always gravitated towards that field and that specialty. And then my father, who had a really big influence in my decision, was a carpenter. And so growing up, I spent a lot of my youth like working on houses, helping them on the construction site. And I actually started to do that myself in high school. So I helped frame houses. I also did interior trim and cabinets. And if you look at the tools that those folks utilize on a day-to-day basis, it's essentially the same thing that I'm using now in the OR, just on a person. So all those things kind of came together and drove my interest into orthopedic surgery. And then within subspecialties, I always liked the real big reconstruction type surgeries. And so I was interested from a surgical perspective and from a research perspective, which was kind of the final straw. If you look at all of the subspecialties now, the most variability in what we do on a day-to-day basis lies within spine. I mean, you could show a case at spine conference, and the running joke is, if you have 10 people in the room, by the time you get around, there's 12 different opinions. And so to me, that's research opportunity, right? So to find a specialty where the country and even the world can tackle the same pathology with different approaches, I look at that as opportunity to prove that one approach or one aspect of it is more beneficial. And so I was very interested in spine from a research perspective as well.
Gosh, what a great story. I feel like there's always a great story behind a great surgeon. And it's so interesting to picture you building houses and now you're building spines. That's so great. Yeah. So one of your specialties is robotic assisted minimally invasive surgery. Can you tell us how more about how this differs from maybe a typical spine surgery or traditional spine surgery?
Yeah, great question. So right now, one of the big themes in spine surgery is using enabling technology, right? And there's a lot of things that fall under that bucket, and robotics is one, or robotic assisted surgery. And what differs from that is, there's a lot of different variation on fluoroscopy. We can use navigation. And now the kind of more common and emerging and popular technology is utilization of robotics. And so to me, it's a conduit to what the future is going to look like, right? So when I got interested in robotics, there was this kind of light bulb that went off. And, we've changed the face of our OR quite a bit over the past 10, 20 years, but what I see our OR looking like in 20 years is drastically different, right? And robotics is going to be an integral part of that. And when I have thoughts or visions or perspectives like that, I want to be a part of that transition. And so that's what gravitated me towards it right now. But our OR with this and the surgery that is unique to this is it allows us to do smaller incisions, dissect less muscle, which overall improves recovery kinetics, right? So it allows the patient to recover quicker, And that gets them back to work, gets them back to things they want to do on a day-to-day basis. And one of the other things that was really important, which we'll get to some aspects later in the conversation, was I found that our patients were taking less narcotics when I started to introduce this, and I live in the kind of one of the epicenters of our opioid issue. And so that became a really important topic to me from a patient care perspective and a research perspective. So, all of that kind of fell into place with robotics, and I started using it and really haven't looked back.
I love that term, recovery kinetics. I think that we think of robotics as, really a surgeon's tool. How can we assist? How can that be an assistant in surgery? But then you really think how that translates into the patient and their recovery, and that really is, I think, important to the patient.
Yes.
And then, of course, there's the research. We know that research has helped lead some of the advancements with innovations using robotic surgery. How critical is past and then future research in helping to ensure that patients have the very best options and recoveries for them?
Yeah. And so we, spine surgery is unique in several aspects, and research is unbelievably important for spine surgery and really everything we do on a day-to-day basis. I mean, this term, as I was a medical student, of evidence-based medicine, right? So using research and tying that together and how you practice clinically is the basis of really what we're doing in medicine overall. But one thing that's unique in spine surgery is it's not um, it's very clear that what we do is pretty expensive, right? So if you look at the cost to society, the cost to a hospital, to cost to even an insurance company who pays the bill the majority of the time, it is not typically cheap procedures. And what comes with that, I feel I add value. The other spine surgeons across the world feel like they add value. It's our job to show that it is valuable what we do, and that's kind of from a cost effectiveness or cost and outcome perspective. And so I think research, especially as we layer in robotics, navigation, virtual reality, whatever the next nice cool tool in the toolbox is that helps improve outcomes, we need to show that we're not only improving outcomes, but we're still improving cost of care, right? So if you look at where this country spends money in healthcare, spine is actually very high up on that list because the expense. And I'm not going to be able to use that next cool robot if I don't show the value of that. So that's where robotics and my kind of economics and spine search kind of married together very well and worked out well.
Yeah, we want our patients to have access to the best treatments, so we have to show that it's worth the cost.
Exactly. Exactly.
You mentioned earlier that you like doing the big reconstructive type surgeries, and you've worked with many people who suffer from spinal deformities, which can be a challenging group. And so, with the technology that we have improving every day, are you able to provide any assurances that, to kind of calm the fears that patients have who maybe sought surgical opinions years ago, were afraid of the type of big surgery and the long recovery, and kind of just shied away from it? Can you help them maybe get to understanding how things have changed and maybe it's not what they think it looks like?
Yeah, definitely. And research helps drive that discussion, right? So I say to my patients almost on a daily basis that my job is as a surgeon is not to convince you to have the surgery, right? So, it's interesting because we're in a role that we love to operate. Obviously, we feel we add value to our patients and improve their lives, and it boils down to are we actually pay our bills by operating, right? So but that's really a conflict of interest when you're giving a patient proper consent and education of the procedures we're offering. And so, in the office, you don't want to be, I try very hard to not be salesy from a surgeon perspective and convince them to have surgery. I say every day, my job is to educate you and give you the facts and give you the options, right? And what the research interest I've had in deformity and robotics and other areas have allowed me to do is I understand what that recovery looks like, what that complication profile looks like, right? If you're not somebody that keeps up on the literature, whether you're involved in research or not, you may have misinformation as far as what that looks like. I love, almost, well, one of my favorite surgeries in the world to do is these big adult reconstructive surgeries, but the complication profile of those is unbelievably high, right? And so when I sit in the office, I'm able to lay out, hey, this is what it looks like. And lines I always say, you're gonna hate me for a couple weeks to a month afterwards. Complication is probably gonna happen. Here's the likelihood of X, Y, Z complication, and here's the facts. And I help guide their decision. But that's I think that's really valuable from a patient perspective versus a surgeon, tapping you on the shoulder saying it'll be fine, right? Don't worry, everything will work out. If you don't give them reasonable expectations, they're not going to be happy, right? And so research has really helped me in that patient interaction, that patient discussion, and I think that improves their outcomes down the road.
Definitely. You have to provide that proper expectation. Do you think over the course of your career, though, maybe the discussion on the type of surgery for a spinal deformity patient has changed to the type of surgery you do now for them?
Definitely. I mean, the easy answer to that is we were really stuck about a decade ago on this kind of algorithmic approach of, this patient gets this surgery, which was actually more invasive than what we've been doing now. Even if you take the robotics or the navigation or the minimally invasive perspective out of it, we were doing a lot more aggressive spine deformity surgeries a decade ago. And now we've figured out ways through predictive analytics, through larger data sets to tailor the surgery down to what that patient really needs. And that customized approach is really improved outcomes in spine deformity surgery. And so, yeah, the screws may look pretty similar, the table may look pretty similar, the OR may look similar, but the approach and actual treatment that we offer has been tailored down and customized for the patient a lot more so over the past decade. And I think as we move forward, one of the big things in deformity, especially because not many people do these big surgeries, is how important the data is, right? So we have groups across the country and really across the world that have come together and combined these data sets to where we can now make much better informed decisions on what's appropriate for certain types of pathology, patients, and the symptoms that they're having.
Yeah, I think that's such great news for maybe a difficult population and one where not every spine surgeon treats spinal deformities, and so they might have a limited access to care. So that's good news that not only have things change and improve, but the recoveries can be better.
Yeah, definitely. And one of the points that you brought up was limited access to care and surgeons that don't do a bunch of them. If you look into orthopedics, the hip and knees that are done, total hip, total knees, unbelievably common procedure. About 75% of hips and knees, total hips and knees are done and from surgeons that only do 20 to 30 a year. Right? So on one hand, you have these surgeons that do 400, 500, 600 a year, but the surgeon that does 20 or 30 a year, right? And most of them are done by the surgeons that do a pretty low volume. And so, if you translate that concept to spine deformity, the surgeon that does one a year, right, is a little bit different than the person that's doing them on a day-to-day basis. And so, we're also finding that the data shows that, make sure you're going to a center that is experienced and not just in the surgical technique, but even the post-op care, right? If it's a center that's not used to taking care of these bigger type of surgeries, the ICU care may not be there, the ancillary care, the therapy, etc. So we've definitely found that the data helps support theories like that.
Yeah, yeah. So my last question is, what research are you working on now and that you find maybe most exciting for the future? Is it the economics? Is it the new tools? What do you have going
Yeah.
on?
Well, so obviously, I love any sort of research and work that rolls into robotics and the economics aspect. I mean, I don't think I'll ever let go of those. To me, what gets me real excited is proving value in what we do, right? So, I spent a long time in training and in the surgeon lounge. You always hear people complaining about things, and in my mind, I always wanted to show what's valuable and this is the right path for us to take. But the most exciting research that I've really dove into over the past couple of years is efforts to reduce opioid consumption, right? And again, this goes back to where I kind of set my roots up here in Louisville, Kentucky. That was really in the heart of this opioid epidemic. And what I was finding, as a young, naive resident or medical student in training, I always thought that it was the patients that ended up in this bad situation because they wanted more narcotics or opioids. And come to find out, they've just, sometimes they end up in physicians' offices, and next thing you know, 2 years later, they're on this massive amount of opioids, and there's not much light at the end of the tunnel. And so we've done a ton of effort in our research and clinical pathways to where we've reduced opioid consumption as much as 75% in spine surgery patients. We're getting ready to publish, I think we're up to about 500 patients now, where when they're asleep, there's no opioids utilized. So throughout the time we put them to sleep to the time they wake up, we use zero opioids. And we're trying to adjunct that with blocks, which is very common in total knees, ankle surgery, arm surgery, things like that. Now we're incorporating those concepts into spine surgery when we go through the front, when we go through the back. The other thing is, how do we manage that pain afterwards? Obviously, it's quite a bit of pain, and we can't utilize some of the medications our total hip and total knee surgeons use because it's not the best for our fusions. And so we're trying to find adjuncts. One study that we're doing right now that I'm real excited about is an adjunct. It's a randomized control trial. It's actually looking at oral THC. And there's, that's a whole class of compounds that has not been studied too much in orthopedics. I would say over the past 12 months to 24 months, there's a lot more literature coming out with that, but we've designed a really good study, which wasn't the easiest thing to design in Kentucky, which is a non-medically legal state. But, things like that we're starting to see patients go through the process, say for a single level fusion. They walk in the door, they walk out of the hospital, go home with zero narcotics. And that's not easy to achieve. And so we're not there yet, but hopefully over the next couple of years, we help develop an algorithm to where patients are coming in and their risk of being on opioids long term or any addiction or dependence is really mitigated there. So I would say that's kind of the newest and most exciting research efforts that we've jumped into here.
Wow, that is so interesting. I know that the research needs to be there, and didn't realize we know someone who's doing it. That's such great news. I can't wait to hear how this comes out.
Yep. So we're probably about a fifth of the way through our enrollment process, and hopefully in the next year and a half, we'll have some good data to support our theories.
Excellent, excellent. Well, on behalf of the foundation, all of our viewers, and everyone listening, thank you so much, Dr. Gum, for joining us. We really appreciate your insight into research and highlighting that, and also everything that you do for your patients. We really appreciate you taking your time for us today.
Yeah, well, I really appreciate the opportunity to talk about the research. Again, it's such a critical part of patient care, and so I think it helps augment and prove value and give us a chance to take care of our patients best as possible.
Thanks so much.